it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com. Happy New Year, happy 2022. This is my first video of 2022, and keep those suggestions coming. We're all about free, complimentary orthodontic education. We put it out there so that you can learn good, high quality, comprehensive ortho without having to pay a huge penny, so you can offer this service to your patients. And yeah, keep those suggestions coming. We're by request. So today the question is, should you ban 6's or E's in your RPE cases or any fixed appliance cases really? Let's clarify what the difference between a 6 and an E is. This might be terminology you're not familiar with, especially if you are a US general dentist. We call 6's in the wonderful world of Palmer numbering system for orthodontics, and most of the international community calls 6's your first molars, the ones that come in when you're 6. So that would be 3, 14, 19, and 30. Those 4 teeth, this guy, this guy, this guy, and this guy, or these guys, or these guys. Those are your 6's. Your E's are your first, or sorry, see, I'm getting this wrong. Second baby molars, your 2-year-old molars, the molars that the babies get at age 2. And do I have any in this picture? Yes, I have some right here. There's an E, there's an E, there's an E, and there's an E. Okay, so remember, those usually exfoliate around 11-ish, 11 and a half or so, maybe 12. And then your second premolars or second bicuspids come in and take their place. So the question is, if you're doing an RPE, which ones should you ban? Well, of course, that depends on what it looks like in the x-ray. Take a look at your x-ray. I always take a look and think, hey, what are the benefits? Well, the benefits of banning the E's or the baby teeth is that it's baby teeth. And you don't have to worry about things because they're going to fall out later anyways. Also, it tends to be a little more comfortable in a younger patient, because when you try to ban these 6's and when the 7's haven't come in fully, often it's really pinchy in the back. There's usually some gum back there, and it's really uncomfortable for the patient. It never quite seats fully unless the patient is older. So in a younger patient, I usually ban E's. In an older patient who has their 7's in, their second molars, I'll usually ban 6's, of course, because the E's are out. The main thing is you don't want to be banning the E's if you think they're going to exfoliate during or anytime near treatment. So, you obviously want to take a look at the x-ray. In this case, your 5's, which is the second premolars, are not even a quarter of the way developed, the roots. So we're good to ban E's here because these aren't going to fall out. How long is my RPE going to be in? Well, we have lots of videos about that. But in general, I'm actively turning for 2 to 3 months. I tend to do things a little bit slower just because I am working with general and pediatric dentists, and weird and crazy things can happen when things are overturned. And I just find that going a little bit slower prevents problems. Now in an ortho practice, did I expand rapidly, like 1 to 2 turns a day? Absolutely. But that's because I have full control of that patient. They're coming in regularly. I know who they are. My team understands what to do. My front desk understands the emergencies that can occur, right? But in a general office, your whole team is not trained up on the emergencies that can happen with this. That's why I recommend that you take it a little bit slower and just see all my other videos for more instructions on that. But hopefully that answers your questions on E's versus 6's. All right, thanks so much.